I think this work is quite exciting. This is a brand new way to treat cancers and it has applications across a very wide array of different cancer types. It's the first drug really of its kind that I've seen that can do that. My name is Dr. Andrew Stevens and I'm from the Hudson Institute of Medical Research. Together with Invion, we have been working on new photosensitizer technology for the treatment of cancers and other non-malignant diseases. We've recently finished some of our initial proof of concept studies using Invion's new active pharmaceutical ingredient, Inv043. An API is an active pharmaceutical ingredient, so this is the drug that does the work in pharmaceutical compounds. All drugs comprise active and inactive components. An inactive component would be the syrup in cough medicine, for example. An active component is the actual drug, so for example paracetamol that's in a Panadol tablet. Inv043 has been specifically selected to have very high activity and has been designed to be taken up into cancer cells specifically. In vitro testing showed us that Inv043 has exceptionally high activity. It's around 500 to 600-fold more active than similar compounds that are used clinically. And it's also several hundred-fold more active than Invion's previous API called IVX-P03. We've also found that in vivo, Inv043 localizes very specifically to cancerous tissues. Inv043 is a photoactivatable compound. So the compound is administered as an inactive form and it localizes to tumour tissues and any excess compound is cleared very quickly from healthy tissues. Once it's localized to the tumour, it can be activated using a very specific wavelength of red light. That causes the compound to transfer energy from the light and generate what we call singlet oxygen. And singlet oxygen is a very highly reactive molecule that damages biological structures that are at or very close to where it's been produced. So the outcome of that is it's basically like a small explosion inside the cell and the cell is damaged and ultimately dies. Inv043 has been looked at fairly extensively for any toxicity associated with it. There are two aspects to the toxicity. The first is toxicity that's associated with administration of the inactive compound. Now, we have used doses up to 2,500 times the therapeutic dose and we can find no toxicity whatsoever. Pending more formalised studies, of course, that bodes very well and suggests that it's unlikely that there will be any toxic effects. The other aspect of the toxicity is when the compound is activated. Now, of course, with chemotherapy, for example, people get quite sick when they're treated, and that's because of off-target effects, so the chemotherapy acting other places than the cancer. With Inv043, it is localized very, very specifically to the cancerous tissue, and so off-target effects are really quite unlikely. We recently completed proof of concept studies using Inv043 to treat different kinds of cancerous tissues. And those studies were structured specifically to look just at the ability of Inv043 to damage tumour tissue. So we looked at three different kinds of cancers. They were T-cell lymphomas, pancreatic cancers and triple-negative breast cancers, all of which obviously have clinical importance and are typically quite difficult to treat. So the results were quite striking. Inv043 was very effective at treating all of those types of cancers. And the treated tumour tissue, we did not see any regrowth over the experimental time period. So really it was a very effective proof of concept study. One advantage of photosensitizing agents in general is that many of them are also fluorescent when they're exposed to blue light. Now Inv043 is special because it has a very high, what we call quantum yield, which means it's very good at absorbing and then emitting light photons. The ability of Inv043 to become fluorescent is so good and the fluorescence is so bright that in fact when you use a very low intensity blue light, it fluoresces very brightly red and you can see very small tumour deposits quite clearly by eye. There's also a potential to use INV043 in what we call the theranostic space, which is as a therapeutic and or as a diagnostic. And we can use it for doing things like looking at very small tumour deposits that can't be seen, for example, or to define margins of a tumour, to assist in surgeries or to treat and ablate any remaining tumour that's present. Our proof of concept studies have really shown us a number of quite significant findings for INV043. It is a non-toxic compound, it is highly active, it is very specific for the tumour tissue, it's cleared very rapidly from healthy tissues and so side effects are low. Probably one of the most important features at this point, I think, is in fact the specificity for the tumour. Standard chemotherapies obviously have a lot of side effects associated with them. INV043, because it is very selectively taken into the tumour tissue and that's where it acts, those side effects are mitigated, and so really we have a very safe and very effective drug.